video on breast cancer by Tatiana, Natsha, Betty, and Poonam. Meet Molly. Molly is a 65-year-old female. She is 5 feet 6 inches tall. At 200 pounds, she is considered obese. This is her story.
One day I was just taking a shower. Then suddenly I noticed it.
Da da da!
A lump!
After discovering the lump, Molly took a trip to see her doctor, where he diagnosed her with breast cancer.
Hello, Molly. How can I help you? So, you have discovered a lump in your breast. Have you experienced any recent symptoms, such as changes in your breast size or shape, changes in the skin of the breast, nipple discharge, or any other changes with your nipples?
Actually, now that I think about it, I have.
I think you may have breast cancer, but before we can be sure, we need to run a few tests. I will start with performing a physical examination on you. Then we can do further tests, starting with a mammogram and a biopsy.
You say I might have breast cancer? What exactly is that?
Well, according to the Canadian Cancer Society, breast cancer is a malignant tumor that starts in the cells of the breast. Malignant means that it can spread or metastasize to other parts of the body. In cases of cancer, DNA undergoes a series of genetic mutations over long periods of time. This leads to the production of various mutated cells, which may grow in an unregulated manner, causing cancer. 1 in 9 women in Canada will have breast cancer in her lifetime.
I'm still a little bit confused. Can you elaborate a bit further?
Sure. Let's start by talking about the normal anatomy and physiology of the breast.
Before we get into discussing Molly's condition, let's talk about the normal anatomy and physiology of the breast. The healthy breasts contain multiple structures, including the lobules and duct system, which are components of the glandular tissue. The other components of the breast are the fatty tissue and the connective tissue, which together make up the supporting tissues. The breast also contains an intricate network of lymphatic vessels, which function to drain lymph from the breast area. This includes the supraclavicular nodes, the infraclavicular nodes, axillary nodes, and internal mammary nodes. Further division of the axillary nodes includes level 1 lymph nodes, found in the low axilla, level 2 lymph nodes, found in the mid-axilla, and level 3 lymph nodes, found in the high axilla. The supply of blood to the breast is achieved by the internal mammary gland.
I think I understand the normal breast a little bit better now, although I still don't know what caused this to happen to me.
Alright, well there are many different causes of breast cancer. I'll explain one common cause. The HER2 genes in the breast cells are responsible for making HER2 proteins. These proteins then act as receptors in the cell membranes of breast cells. Normally, HER2 proteins function to regulate the growth of cells as well as their differentiation.
There are many contributors to breast cancer, one of which is HER2 gene malfunction. This malfunction, which is present in about 25% of patients who have breast cancer, leads to an overproduction of HER2 genes, which is referred to as HER2 gene amplification. This in turn causes an excess production of HER2 receptor proteins, which is also called HER2 protein overexpression. As a result, breast cells divide excessively in an unregulated manner. This causes an overproduction of breast cells, eventually creating a tumor. The hormones estrogen and progesterone contribute to normal bodily function by aiding and stimulating the lobules of the breast, as well as causing enlargement of the milk ducts during menstruation. However, they may contribute to tumor growth. The symptom Molly noticed, the lump, is actually the tumor. When a tumor forms in the breast, homeostasis is affected. The cancerous cells invade the breast tissue and often break off. If this occurs, the cancer will metastasize, which means it spreads to the rest of the body because it gains access to the lymph system. As it spreads, it will invade other tissues around the body. This inhibits the correct functioning of these tissues, affecting homeostasis.
Thank you. I understand what can cause breast cancer, but why did it happen to me?
There are many different risk factors for breast cancer, including being female, older age, being Caucasian, a family history, extra weight, and combined hormone replacement therapy. You have several of these risk factors, which makes you more prone to this type of cancer.
Okay, so if I do have breast cancer, what can I do to treat it?
There are many different forms of treatment, and some are used in combination with each other. Some common treatments include chemotherapy, which is the use of drugs that will interfere with cancerous growth and spreading. However, it does negatively affect healthy cells and has some side effects. Hormone therapy inhibits the action of estrogen and progesterone, and a mastectomy is the removal of the breast.
Thanks for the info, Doc. I think I get it now.
Thank you for coming in, Molly. I will schedule you for a mammogram and a biopsy right away.
In summary, the HER2 receptors are proteins that are found in the cell membranes of breast tissue. When these proteins overproduce, they can create a malignant tumor. When the tumor grows, cancerous cells may break off and spread throughout the body, causing cancer to form in other organs, inhibiting their effective functioning and therefore disrupting homeostasis. Normally, estrogen and progesterone help the body maintain homeostasis, but in the case of breast cancer, they may increase tumor growth, disrupting